Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Balada from Roots Community Health Center, reporting for the week of June 7th, 2021. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID 19, we are here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments by direct message or by email to admin@rootsclinic.org. Now, we know that even though the pandemic is worldwide, its effects are very different depending on where you are. So, we are here to give you up to date information about Alameda County, Oakland, and East Oakland in particular. County-wide cases are continuing to come down nicely. As you can see here, over the past 14 days, there have been about 500 cases. So that's not zero, but it's nice and low compared to where we were. The last time we were actually this low in Alameda County was right around when things got started back in April, May of 2020. So certainly we have reason for optimism. Unfortunately, we do still have disparities. The positivity rate for the county overall is 0.8%, so less than 1%. But in East Oakland's 94603, the positivity rate is triple, more than triple, at 2.5% positivity. And so while we certainly have reason to be optimistic about how we were doing overall in our county and here in California, it's important that we keep an eye on disparities and also that we don't lose sight of where we are overall in the pandemic. So worldwide, you can see here daily new cases. This graph still looks like the COVID roller coaster we've gotten used to looking at. Daily cases worldwide are about 400,000 new COVID cases per day, which is right around where we were last fall, around Thanksgiving or so, before they went back up. And daily deaths are still concerning at about 10,000 deaths per day worldwide, which is where we were around Christmas time last year. So, until we get control of the situation worldwide, we do remain in a global pandemic. And as long as the virus is replicating at this rate, no matter how far away it may be in the world, we remain at risk of emerging variants. Remember, it only takes one plane ride to import a new strain that may be more deadly, more contagious, and at some point, and gratefully we are not there yet, but at some point they could even evade the vaccine. For now, our vaccines are providing very good coverage in general, even against the variants, which is why there is a relaxation of the guidelines for masking and distancing coming up here in California on June 15th. So if you are vaccinated, you will be able to be a little bit more relaxed. But if you are unvaccinated, the picture for you remains a little dicey. You're still playing Russian roulette with COVID, which may not be as risky now in terms of the overall numbers because it's not circulating as much in our environment as it was before for now. But you only need to be exposed once to contract COVID. And in terms of some of the variants that we are seeing right here in Oakland, which is essentially all of the variants that we know about have been detected right here in Oakland and across the county, it is actually more risky once you are exposed because these variants are all more contagious and some of them are also more deadly and they're still evolving. So, our biggest concern now is really for our remaining unvaccinated. So, in my regular review of what we are discovering with COVID and among COVID survivors, I came across this article in the lay press that says erectile dysfunction risk 6 times higher in men with COVID. And I was pretty shocked because first I had not heard this before, and mainly because this is a major quality of life issue with a lot of other potential implications to it. I reviewed the literature, which has some compelling surveys and some very eye opening case studies. But it seems that the information is kind of late breaking and still coming in. So I said, let me call a colleague with some expertise and some real time on the ground experience with this. So I'm very pleased to have as my special guest today, Dr. Dawood Lankford, to help us get up to speed on what is going on here. Welcome, Dr. Lankford. Thank you for joining me today.
Thank you for having me.
So, before we dive right into this important topic, let me just run down some of Dr. Lankford's bio here, since we all know that we have to be very discerning these days, especially these days, on who our sources are. So, Dr. Lankford is a MD, MPH. He received his medical degree from Meharry Medical College in Nashville, Tennessee, and his master's in public health from UC Berkeley. He completed not one, but two fellowships, one in endourology and robotics, and the other was a clinical research fellowship in urologic oncology at the National Cancer Institute in Bethesda, Maryland. He is a very well respected urologist who is in private practice right here in Oakland, and he has a special interest in health care disparities and large scale public health interventions. So I think you can see why I've invited the good brother Dr. Langford here to help us shed some light on this topic. So I guess my first question is, there's so much misinformation and disinformation out there. So is this for real? Have you been seeing this and hearing this among your colleagues?
Yes, I was recently in Miami and at a prominent erectile dysfunction clinic, and we are seeing an increased number of people coming in complaining of erectile dysfunction, new onset, after having had COVID-19. So I would answer your question and say that yes, this is something that we're seeing.
Okay, so that it does feel like a little bit of a bombshell because, like I said, we've been hearing a lot of things about what COVID does and what long COVID does, and this is pretty major. So maybe we could just take a little step back and say, what is erectile dysfunction?
Erectile dysfunction essentially is described as the inability to get an erection or maintain your erection. But also, we add in there the inability or the difficulty with having satisfaction with your erection as well. And this has to be maintained over a period of time. But if we look a little bit larger, if we broaden our scope, erectile dysfunction is seen really as a surrogate for health status. We find that a lot of people with erectile dysfunction also have a lot of chronic conditions concerning their health: diabetes, high blood pressure, cardiovascular disease.
So you mentioned some of the underlying conditions that can maybe lead to erectile dysfunction, and maybe we can just get a little more technical about what causes erectile dysfunction.
Part of erectile dysfunction is psychological, right? You have the psychological issues, sort of the confidence of obtaining an erection. And then part of it is hormonal. We have our actual testosterone levels and our hormonal levels that help us obtain erections and have the actual desire, or what we call libido, for sex. And then also there's the anatomical or the functional element that has a lot to do with the blood vessels and does your blood vessels work properly? And so it's the collaboration of all of those things that produce or cause erection.
Why would that happen? Do we understand why COVID would cause erectile dysfunction?
Yeah, well, there's been a few studies that have come out of Italy. There's a number of studies out of Italy that have sort of explored this connection because it's quite important when you look at the grand scheme of things, when you talk about planning for early interventions for people who have erectile dysfunction with this COVID crisis that's hit us. And so one of the mechanisms that people have looked at is they've looked at sort of overall the cytokine storm that happens and causes an inflammatory state. And this affects endothelial cells and causes endothelial dysfunction, namely with intravascular coagulation. That is basically clots that form in various blood vessels. And we know that erections need blood vessels to develop, to create an erection. But also, what I thought was very interesting is in some of the studies in Italy, they actually look at the testicular tissue in people who had been infected with COVID-19, and they found a decreased number of the cells that produce testosterone. They also found decreased ratios of testosterone to other hormones. So what we know is that people who've been infected with COVID-19 perhaps may have a lower level of testicular tissue, basically a lower level of which produces testosterone, so a lower level of testosterone. Also, people with COVID have a lot of clots all over the body, and these clots can be producing poor erections. And then, some of the data from some of the studies were from online surveys. There's something called the Sex at COVID online survey. And they did something which we call a sexual health inventory for men. This is something that every urologist pretty much across the world uses to assess someone's sexual function. And they found that there was an incidence of erectile dysfunction among people who had COVID-19, about 28%, versus people who did not have COVID-19, about 9% or so. So we're getting online surveys, and we're getting sort of, these chronic conditions and post-mortem findings that are showing us that, COVID does affect people's ability to have erections.
Wow. So that was quite a number of possible mechanisms or ways that this could be happening. And they sound similar to, because we at first we thought COVID was just sort of respiratory, right? And then all of a sudden we realized, okay, this is causing inflammation and it's affecting every organ. So in a sense, is this similar to how it's affecting other organs? And this is just other organs that it's affecting. So it's not sort of out of left field. I mean, this kind of all makes sense.
Yeah, I would 100% agree. I think that, when we start to understand the virus and we start to understand what it actually does, how it's a systemic disease. And so this is just right in line with all of the lung, the heart, the blood vessels, and now the testicles, even the limbic system or the endocrine system as well. So I think we're just understanding how all of these health conditions are interrelated.
How do you treat erectile dysfunction?
It takes a lot of questioning and talking to see sort of what's the cause of the erectile dysfunction. But once there's a cause that's identified, sort of the first step is medications. We have something called phosphodiesterase inhibitors, the Viagras, the Cialises, the Levitras. And about 30% of people, give or take a percentage, are successful with just the medications. There's other steps that go down the list. There's intraurethral, there's suppositories that you put inside the urethra that help you obtain erections. There is vacuum-assisted devices that help you obtain erections, and these are all used if the oral medications don't work. And then if those don't work, we go on to injectables. There's injections that you can do into the penis itself to help you achieve or maintain your erection. And then last but not least, a more radical approach is placing an inflatable penile prosthesis. And I stress that one of the important things when you do understand if you're experiencing erectile dysfunction is coming in and having an early intervention. So with the early interventions, and some of those interventions may involve changing your blood pressure medication or assessing and finding out if you have diabetes or some sort of other cardiovascular issue. And so once that's sort of done and that's optimized, right, then if someone fails through all these treatments, like we just discussed, the oral medications, the vacuum-assisted devices and other related intraurethral suppositories, injectables, and then they go on. So they fail all of these options. They're least invasive. The maximally invasive procedure that we do use to treat erectile dysfunction is an inflatable penile prosthesis. And this is essentially a device that's been around for 50 years or so, a very long time. And it's placed inside the penile tissue itself, and it's normal saline, just water, that's used to pump up this device to achieve an artificial erection. Your partner wouldn't know that you have it. They would. It's inside the body, but it is a major surgery that involves being under anesthesia. And this device is a device that's basically a foreign body. It's almost like putting in an implant, like if you had an artificial hip, artificial knee, it's an artificial penis.
So I am sure that anyone who's not currently experiencing erectile dysfunction would like to understand, how do I prevent experiencing erectile dysfunction?
Yeah. I think prevention is the most important thing. And then also, one of the things that's very important is understanding that erectile dysfunction or issues with erections is a surrogate for other systemic health issues. So we have to, so if someone comes in or if you're experiencing erectile dysfunction, then a real clean and hard evaluation of your entire body should be done by your primary care doctor. So you should go into your primary care doctor, you should get your blood pressure checked. You should get your diabetes and your blood sugars checked to make sure that you're not a pre-diabetic or you're not experiencing diabetes. If you are, you should control your diabetes or try to understand how to control your blood pressure if you are hypertensive. And then once you've been evaluated from a medical perspective, then we look at more. Okay, what is going on with the penis itself? Um, do you have a vascular issue? There's vascular causes for erectile dysfunction. Vaccination, perhaps preventing yourself from getting COVID-19 altogether. Wearing a mask when you're in a high risk situation, when you're around others that you don't know their vaccination status. I think all of these are ways that you can prevent having your erectile dysfunction and having COVID.
So, what about people who've had COVID and are now experiencing erectile dysfunction? Do you think that, just based on your experience and expertise, do most men come, see you right away when they're experiencing this? Do you feel like we have a good handle on how many people are really going through this, including post COVID?
Yeah, so I think that this getting this information out there is important because it helps people having early interventions. So I think that if you're experiencing erectile dysfunction and you've recuperated from having COVID, this is a important time for you to come in and see the urologist. You're going to come in and see the urologist, and you're going to describe your symptoms. Now, many people across the country have started to prescribe the phosphodiesterase inhibitors, that's medications, and also check testosterone levels. And perhaps testosterone replacement therapy could be right for you. But you never know. We don't know how long this sort of hypogonadal or low testosterone state will last. The chronic issues that are caused by COVID, no one knows because, this disease has been here for just a short period of time. However, early intervention is a preventative mechanism because it prevents you from having chronic issues with the penis, which would require you having one of these penile prostheses or a more aggressive procedure.
Okay, so early intervention. So that really makes me wonder, because sometimes when I'm watching TV late at night or I'm browsing around the internet, I see these ads, coming up for like male enhancement or things of that nature. And I believe that's still in the same category of what we're talking about. So what's happening with that? Do you see a lot of people who are trying to kind of take matters into their own hands? And what do you say to that?
Well, we live in a world with social media, YouTube, and these instruments are very good because they educate us. However, they also provide platforms for people to sell us things without having proper advice, proper counseling. And so, yes, I think a lot of times we have medications that are being sold online that are targeting men. And so I think that we just talked about how erectile dysfunction is a surrogate for other healthcare issues. And if you're not, people need to have an adequate evaluation of their health. It's possible that they could be taking these medications and that may not be their problem. The erectile dysfunction is just another issue. It may have to do with the blood pressure medication, and it's not adequately been changed or been prescribed, and maybe it needs to be changed a bit by the primary care doctor. And so that's why I would say people trying to take this into their own hands, perhaps they should first be evaluated by their primary care doctor, and perhaps have a discussion with a urologist so that we can sort of holistically approach the issue. Yeah, really, I would like to say, or just educate people, tell them erectile dysfunction is something that is completely treatable. And so it's important for you, if you're having some problems obtaining your erections, maintaining those erections, come in to see your urologist. Talk to your urologist, and you can live a very happy life. You can sort of not have to suffer or have to have this problem where your partner, one of the things that was also very interesting is the psychological distress that COVID has caused on the community here in the Bay Area. A lot of people are very distressed. And then if you have erectile dysfunction, this may be a strain on your relationship at home as well. So these are all of these things are interrelated, and coming in to see your physician, your primary care physician, and your urologist is important to help you cope with these issues.
I know this has not always been an easy topic for folks to talk about. I can say that as a primary care doctor. Not everyone wants to talk about this.
Well, I really appreciate being here. First of all, I want to thank you for having me to talk to the community.
Well, there you have it. So, in case you needed another reason not to catch COVID, there it is. If you have already recovered from COVID and you are suffering with the symptoms that Dr. Lankford just reviewed, you already said intervene early. Do not suffer in silence. Don't take matters into your own hands. Go to your primary care doctor, get checked out, and get a referral to the urologist. This is treatable. It's also preventable. It also could be a window into other issues or underlying conditions that could be going on that you may not know about. If you have not seen your primary care doctor in a while, please go reach out, get one if you don't have one. If you have chronic medical conditions, please go see your primary care doctor. Let's get the blood pressure checked, the sugar, cholesterol. Do what you can to stay in tip top shape. Keep up good nutrition and physical activity. Take a multivitamin and additional vitamin D supplementation. Manage your stress and get a good night's sleep. And let's not forget all of our layers of COVID protection. Those include vaccination for those 12 and up, masking and distancing, testing and quarantine. Test if you have symptoms, whether or not you've been vaccinated. And if you've been exposed and you have not been vaccinated, please get tested. The earlier, the better, so that you can get treatment if you're eligible. And in indoor spaces, we're wanting to avoid crowded indoor spaces and ensure that there is good fresh air circulation and filtration, and that we are disinfecting and sanitizing, especially our high touch surfaces. This concludes today's People's Health Briefing. Thank you for joining us. Please tune in next Tuesday at 10 a.m. See you then.